Namaskaram. This is Dr. Swapna Reddy from Siddha Nagarjuna Ayurvedic Clinic and Panchkarma Unit and Yoga Center from the Dr. Esra Nagar. Today I am going to talk about the thyroid problems as dealt in Ayurveda. In Ayurveda, we claim that we are able to solve most of the thyroid problems and we do not subject the patient to any hormones. Without giving the patient the hormones from outside, we are against giving hormones to the patient from outside. The gland which is not functioning properly, the thyroid gland needs to be reactivated and made to function properly rather than giving some medicine from outside which needs to be given forever, like the thyroxine hormone. The gland is not able to prepare, so you are giving it from outside, so the gland will never function. For example, gland has become lethargic and it's not able to function properly. You are giving it something which is not able to produce from outside, then the gland will never function. That is our concept. So what we do in Ayurveda is we activate the gland and stabilize the gland so that it will produce the thyroxine by itself. So normally in Ayurveda there is no separate entity like the thyroid disease, but the Sthaulya and the Karsha, the two types of metabolic disorders are treated in Ayurveda, and the Sthaulya one is the hypothyroid one and the Karsha is the hyperthyroid one. Normally, when we talk of thyroid, when you see the report, the thyroid TSH, the thyroid stimulating hormone, is produced in the brain, and that thyroid stimulating hormone stimulates the thyroid gland to produce the T3 and T4 hormones which are visible in the sheet. And normally, if the T3 and T4 are more, we will be having the hyperthyroid state, and if the TSH is more, it is the hypothyroid state. The thyroid stimulating hormone tries to stimulate the gland to produce more because of the less production of the hormone, and if the hormone is produced more, it is the hyperthyroid, because of which a person becomes lean. In either of the cases, normally in the modern science, whichever hormone, if the hormone is not being produced, the hormone is given from the outside, but we are against it. So herein we have certain medicines which will be activating the gland and stabilizing it. So when we say of it, the most commonly used medicines are the Kanchanara Gugulu, Bauhinia variegata, a plant bark from which the Kanchanara Gugulu, a medicine, is prepared, and also the Arogya Vardhini Vati. So these two medicines are given to activate the gland, and it being a metabolic disorder wherein which the T3 and T4 which are produced by the thyroid stimulating hormone activating the gland will be controlling the entire body. The cellular metabolism of the body is under the control of the thyroid. So, and there are certain herbs like the Trikatu Churna which activate the gland. The Trikatu Churna includes very simple herbs like the sont, the dry ginger, the black pepper, mirialu, and the long pepper. All the three together are capable of activating the gland. And once again, person to person, according to the Prakriti, we decide as to what to be given, because each person is different. So the wide range of herbs, including the cinnamon, the turmeric, and the simplest of the simplest preparations like the triphala, everything helps in the regulating the metabolic derangement, setting the metabolic derangement to the normal level. And once again, thyroid is not considered as a disease in Ayurveda. So what is it actually? When we talk of thyroid, we should talk of the emotional turbulences and the lifestyle imbalance that we have created in the present world. It's a lifestyle disorder, and the emotional and psychological blocks will only cause the thyroid. Amazingly, when I have kept some of my patients who come to yoga, if we can take a group which has been coming to yoga and some of them without yoga, the yogic people, we were able to deal them more easily because the gland gets stabilized. For example, if we are under stress, we won't be able to function to our optimum level. Similarly, our gland, which is a part of us, a small part of us, will not be able to function properly. It will not be able to produce the thyroxine it is supposed to produce when it is under stress. When we are under stress, it is also under stress, it is also not able to function properly. In yoga, normally the peace and the bliss inside will be maintained. The methods by which the peace inside is protected, because of which the gland again becomes relaxed and happy and starts functioning the way it is. Similarly, the herbs, many of the herbs act on the energy body. They stabilize the glands and make them function properly. In combination with yoga, Ayurveda is able to rule out most of the cases of the thyroid, except for a very few autoimmune diseases of thyroid gland, wherein which the body's mechanism is going against the system. So in such things, and some very few cases wherein the hyperactivity of the gland is happening, wherein the operation is required, and even in those, over a period of time with consistency, they are responding and able to stabilize. So the treatment for the thyroid problems in Ayurveda is definitely superior over the other science, because we are curing the disease rather than maintaining it. Curing, stabilizing the gland and making it to refunction the way it used to be, and also maintaining it for a lifetime in the same manner by changing the lifestyle completely, by giving them the daily regimen, the seasonal regimen, and also maintaining the peace within, so that the gland will always be healthy for a lifetime along with the yogic practices.